Good afternoon, Lisa Homa here. Today we're going to talk about GU assessment. The objectives of this lecture are to talk about inspection, percussion, palpation, and auscultation of the GU system. I'm going to focus on nursing history first. I'm going to give just one teeny little blip about anatomy and physiology. There's not a lot to say here. The main function of the urinary system is to regulate fluids and electrolytes and to help remove waste of metabolism. We're going to focus on, as far as the health history, present illness. Does the patient have pain, burning sensation, UTI? Do they have a urostomy? A urostomy is surgically created from a piece of the large intestine. And then what's important about that is there are cells in the colon which will secrete shreds, mucus shreds. That's just part of what happens in the colon. So a person with a urostomy will normally see shreds in the urine. If I were in ICU and I saw that in my Foley bag, shreds, I might think the patient had some type of infection brewing. But for a person with a urostomy, that is a normal finding. You want to investigate voiding patterns and frequency, past medical history, and current problems with urination. Sexually transmitted infections can cause lots of urinary pain. Diabetes can cause changes, and so can hypertension. You want to look at the appearance of the urine, if there were any culture, scent, and any recent changes, so the amount and the color. Normal color that we expect from urine is to be yellow or straw colored. Factors influencing the elimination patterns are family history of kidney problems. A huge one is polycystic kidney disease. Those patients, they will get a transplant. That is the way that it goes. Like 100% of the time, there is no changing it. It is genetically passed on. You want to investigate also kidney and bladder calculi, so kidney stones. Any medications that the patient is on, specifically diuretics, psychotropic agents, and antihypertensives, will have or influence the urine. A couple medical terms just to refresh your memory. Dysuria is painful urination. Hematuria is blood in the urine. Urgency is a strong desire to urinate. It usually is a sign of inflammation of the bladder, prostate, or urethra. Polyuria is an abnormally large volume of urine. This is one of the signs of diabetes. And this number keeps changing based on the Kidney Foundation and what they're coming up with. Oliguria, I believe that's up to 400 mLs is the amount of the small urine, and that's in a 24-hour period. Anuria is the absence of urine. We see this in stage 4 kidney failure patients. They'll say they're anuric, but they might have 50 mLs in a whole day. And enuresis is an involuntary voiding during their sleep. So to inspect, we want to start examining the abdomen and the urethral meatus. You want to auscultate the renal arteries, although we did mention in the abdominal assessment that is hard to do. They are difficult to auscultate. Percussion includes the kidneys to detect tenderness, palpation to detect mass lumps and tenderness. Percussion of the kidney specifically is to detect tenderness over the costovertebral test. Normally, you'll feel a thud sensation or pressure, but not tenderness. Palpation of the kidney itself, you'll want to know the contour, the size, the tenderness, and if there are any lumps noted. In adults, normally the kidneys are not palpable because they're only palpable if something is abnormal. The elderly, the right kidney is slightly lower than the left, and it may be easier to palpate. So let's talk about percussion of the bladder. Percuss the area over the bladder 5 centimeters above the symphysis pubis. To detect differences in sound, percuss towards the base of the bladder. Percussion normally sounds like a tympanic sound. Remember, that's like a kettle drum, the sound, more hollow kettle drum sound. Palpation of the bladder. Normally, it should feel firm and smooth. In an adult bladder, it may not be palpable. Inspection of the urethral meatus, you look for swelling, discharge, and inflammation. As far as the urine, you want to measure the volume, the color, clarity, and you want to test for specific gravity, glucose, ketones, and blood and pH. And normal volume of urine per day is 1 to 2 liters in 24 hours for a normal, healthy adult. Things we want to look for in the color, and we are pretty good at this, right? If you don't drink fluids overnight, your urine's going to be darker in the morning. The more water in a healthy kidney, the more water you drink, the lighter your urine should be. It should almost look like water. They recommend 8 glasses of water a day, so think about how much that you drink. The smell should be a mild smell. Aged urine is stronger odor, similar to that of ammonia. Also, many drugs are excreted through the kidneys, and so there you could have a smell based on the antibiotic coming out of the system as well. Diabetics will have a sweet or a fruity odor because they have a presence of ketones in their urine. As far as acidity, pH is the measure of acidity. 95% water, 5% chemical solutes, urea from a breakdown of amino acids to give ammonia plus CO2, giving urine, and creatinine from the breakdown of creatine phosphate in the muscle. And that's all I have. I hope you have a great day.